that law.
Right. But let's go take my turn for questions. The stories we've heard here from this panel are heartbreaking, but unfortunately they're not unique. If I can go to slide number 1 there, the Commonwealth Fund Health Survey provides some remarkable data. If you take a look at it right here, this slide's come, as I said, from the Commonwealth Fund report. We'll hear from Ms. Collins next. I'd like to highlight the column labeled underinsured and row labeled used up all savings, like this panel. According to the report, there were 25.2 million underinsured Americans in 2007. This table shows 46% of the underinsured burned through their savings in order to pay for medical bills. That's 11.6 million Americans with health insurance who still spent all of their savings on medical expenses. The table also notes, and you can see the arrows there, that 33% of those underinsured took on credit card debt as a result of medical bills. That's another 8.3 million people. Relying on credit cards, often with high interest rates to cover medical expenses, just leads to greater financial burden. I guess as the chart shows, I think we're just all, the underinsured are just one step away of being uninsured in financial ruin. Mr. Wilkes, let me ask you this. In your testimony, you stated your family relied on credit card and home equity to stay afloat. Is that correct?
That is correct.
Roughly how much medical debt did you finance through through credit, whether it's your home or credit cards?
It was spread over several years. I'm not even sure. I even had to cash in a life insurance policy, spend down our savings, got no savings left. So many bills. I mean, we literally would get stacks and stacks of statements and bills from the hospital, from the insurance company, everybody. So it's impossible to keep track. Just to tell you how impossible it is to keep track, even the insurance company couldn't keep track.
Right, you're telling me you requested one time, it's in your testimony, one of those nice charts you made about...
December 2006, when we were near the cap, we said, tell us where we are, give us a line item list of the bills. We got that 22 months later, a year and a half after he had been capped.
So what would have happened if you would have gone over that, waiting for this information, see if you're near that $1 million cap, you go over the $1 million cap not knowing, it takes them 22 months after request to give the information, all that would have been out of your pocket then?
We had, like I said, we had $80,000 over the cap that we were responsible for. Had we waited another week or two, it would have been well over $250,000.
Could I put up the chart by Mr. Wilkes? Because I want you to try to explain this one. You had it to your testimony. I had a little trouble. I'm in July, about 2002 there. Yep. The green line on the bottom, about, what is about, let me look at this. This is just your total annual premium, right?
The green line on the bottom is basically employee contributions.
Okay.
Just the portion, not the premium that the
employer paid.
The minor portion of the premium that comes out of your paycheck.
Okay. The blue one there, which starts at $7,000 in 2002, is that employee and employer contribution?
Yes, that's basically the full premium.
And then so over 5 years, you went from about $7,000 to over $17,000, the employer contribution. Did you follow that top line?
When we were under the high deductible plan, it was basically a $12,000 a year premium with, by the time we left, it was a $10,000 out of pocket on top of that. So you're, yeah, it was well over $22,000. And that includes, plus funding the HSA that we had for those of us that could afford it.
So it was basically $17,000 for premium, but you had a $10,000 deductible first you had to meet.
Right, it was $6,000. There's another chart in there. $6,000 deductible, $10,000 out of pocket with some co-insurance. The numbers get a little funny, but ultimately we had to. It was a lot of money out of our pocket. So
even with that coverage, even with the $10,000 deductible, you indicated some of your fellow employees who shared that pain with you, financial pain, had to pay for a C-section for the birth of a child. They sewed up a leg on a kitchen
everybody
table.
Else in the company now. I mean, we were the bombs that went off, but they were all casualties all around us. They were all paying this $12,000 premium per family. But every time they had to go take their kid into the doctor or go to the hospital, then they were paying 100% because they haven't even come close to their deductible yet.
Well, I know you mentioned, and Mr. Null also mentioned about one way to get around it is file a divorce, have one spouse get no income, go on Medicaid to pay for these expenses. I'm pleased to see either one of you chose that route, but I'm sure financially you look at it, it makes you think at least once or twice. Fair to say?
Yep.
Mr. Null, let me ask you this. You had to reduce your annual income, you said, to what, $16,013?
That's correct.
In order to qualify, or you had to be below $20,000?
You have to maintain that below that level. It's $1614. You can handle it yourself.
$1614. So $1613 is a magic number. I'm sure you had to divest your assets, get rid of savings account if you had any left by then?
Absolutely, yeah. They do a complete asset search, and you have to liquidate all of that.
How long did you have to, were you on Medicaid then to pay for Tatum's?
We were on Medicaid for about 2 years.
I think you said you had to avoid work or did not take on work because you were afraid to go over that cap?
That's correct.
What would have happened if you went over the cap? You would just be without the insurance?
Yes, they would drop us effective immediately.
During this time, did you look for other insurance companies to see if you could get off Medicaid and try to get some coverage for Tatum?
Yes, sir, we did, and no insurance companies would write us because of the pre-existing. They quote-unquote said they would not even accept our policy for review, or request or accept our application for review, excuse me.
So it was only when you went from a private individual plan to a group plan you were able to get insurance?
Correct.
For Tatum. You indicated Tatum is blacklisted from insurance. Can you explain that a little further?
It's because of her pre-existings. As I mentioned, we could not find any insurance companies that would accept our application with Tatum's name on it.
What if you, well, I guess if you didn't put your name on when a claim was submitted, if you didn't put Tatum's name on it when a claim submitted, it'd be rejected because she's not covered underneath the policy, right? There's no way around getting around it.
There's no way around that, no, sir.
Okay. Ms. Howard, I think we all want to compliment you for the struggles you've been through, but you're still trying to pay it and to not file for bankruptcy. I think you said you didn't want to go down that road. Could you just explain a little bit?
I'm sorry. Oh, I didn't want to go bankrupt.
Why didn't you want to go to bankruptcy? And that was one way to clean your debt, right? You're single, you could clear off your debt. 7 years, you can probably get your credit reestablished.
Yeah, I figure in the next 7 years I might be able to pay this off.
So
I'd like to be able to say that I've stood up on my own throughout all of this.
Well, I think you got the respect of everybody on this committee for trying to do what's right. Not that 62% of Americans who play by the rules had insurance. 78% of those 62% had insurance, but they had to file because they just couldn't do it. So we compliment you for trying to do it. Mr. Gingrey, questions, please.